In 1952, your doctor was the most trusted person in your life. Some of what he told you kept you alive. Some of it nearly killed you. And two treatments on this list that medicine abandoned as barbaric have been quietly brought back into hospitals and are saving lives today. These did not fade because medicine progressed past them. Some faded because they never worked. Some because what replaced them was not better. It was just newer. Hit subscribe. Let's count down. 10. The routine tonsillectomy. In 1955, tonsillectomy was the most common surgical procedure in the United States. Over 1 million American children per year. Pediatricians recommended it for recurring sore throats, for ear infections, for bedwetting, for children described simply as sickly. It was considered preventive, progressive, the modern thing to do. What nobody said out loud was that the tonsils are lymphatic tissue. They are part of the immune system, the body's first line of defense against pathogens entering through the mouth and nose. Studies published through the 1970s and 1980s found tonsillectomy produced no measurable long-term benefit for the vast majority of children who received it. The surgery carried real risks. Children died from a procedure performed not because they were sick enough to need it, but because a generation of doctors had decided, without sufficient evidence, that the tonsils were expendable. The American Academy of Otolaryngology eventually issued strict guidelines limiting the operation to specific clinical criteria. What is most striking is not that the surgery was performed. It is that it was performed 1 million times a year for decades before anyone demanded systematic proof that it was helping. Your doctor was not lying to you. He was doing what he had been trained to do. The training was wrong. 9. Absolute bed rest. After a heart attack in 1950, your father was ordered to lie still for 6 weeks. Not reduced activity, complete immobility. The theory was that the heart needed stillness to heal. The result was muscle atrophy, blood clots forming in the legs, lungs weakening from shallow breathing, and a depression that set in around week 2 and did not lift. For back pain, the prescription was identical. Research published in the New England Journal of Medicine in the 1980s dismantled this entirely. Patients with acute back pain who stayed active recovered faster than those prescribed bed rest. For heart attack patients, early mobilization produced dramatically better outcomes than weeks of stillness. The bed was the treatment. The bed was making people worse. Movement was the medicine the whole time, and it took decades to admit it. In the meantime, patients lay in darkened rooms, following doctor's orders, getting weaker, and calling it recovery. 8. Twilight sleep, a mixture of morphine and scopolamine administered to women in labor. The morphine dulled the pain. The scopolamine ensured she would remember nothing. She was not unconscious. She was delirious, often restrained to the bed to prevent injury, experiencing the full labor with no ability to form memories of it. American women's magazines promoted twilight sleep as the modern, civilized way to give birth. Women's clubs lobbied hospitals to offer it. It spread through maternity wards and persisted in various forms into the 1960s. What the promoters did not discuss was that scopolamine crossed the placental barrier. Newborns emerged sedated, sometimes requiring resuscitation. Mothers woke confused, with no memory of their child's birth and no understanding of what had happened to their bodies. It was not sleep. It was a chemical blackout administered to a conscious woman during the hardest hours of her life. The women who received it did not consent to what it actually was because nobody described what it actually was. It faded when the outcomes became impossible to ignore. 7. Insulin coma therapy. In 1936, If you were admitted to a psychiatric hospital with a diagnosis of schizophrenia, there was a good chance a doctor would put you into a coma. Large doses of insulin drove blood sugar so low the patient lost consciousness. They were kept there for an hour or more, then revived with glucose. The cycle repeated daily for weeks. By the 1940s and 1950s, insulin coma therapy was considered frontline treatment for schizophrenia in hospitals across the United States and Europe. Tens of thousands of patients received it. A controlled study published in 1957 found patients who received it showed no better outcomes than those who received simple sedation. The coma was doing nothing therapeutic. It was simply a coma. The procedure carried a 1% mortality rate. Patients died from it in hospitals that believed they were treating them. It was abandoned not because of a single moment of clarity, but because the evidence against it eventually became too large to dismiss. Here is the pattern nobody inside the system wanted to say out loud. These treatments were not fringe practices performed by charlatans. They were standard care endorsed by medical associations, taught in medical schools, administered by doctors who believed entirely in what they were doing. The problem was not bad intention. It was certainty without evidence. Medicine in the first half of the 20th century moved fast and assumed too much. The controlled trial, the long-term follow-up, the systematic review, these tools existed but were not yet the standard by which treatments were judged. A senior physician endorsed a procedure. Junior physicians adopted it. Patients received it. Nobody asked for proof because asking for proof implied doubt, and doubt felt like a betrayal of the patient sitting in front of you. Your grandfather's doctor was not a fool. He was working without the instruments that would have told him he was wrong. The tragedy is how many people were inside the system while those instruments were still being built. 6. Radium as medicine. In the 1920s, radioactivity was new, and the public was told it was healthy. Radithor was a commercially sold tonic, a small bottle of water containing genuine radium, marketed as a health drink. A prominent American socialite named Eben Byers consumed over 1,400 bottles on his physician's recommendation. The radium dissolved his jaw. It ate through his skull. He died in 1932 at 51. The Wall Street Journal headline read, "The radium water worked fine until his jaw fell off." Radium was embedded in toothpaste, face cream, and suppositories. Watch dial painters, mostly young women, were instructed to point their brushes with their lips, ingesting radium with every stroke. They developed bone cancer, jaw necrosis, and aplastic anemia. They sued and won in a case that became foundational to American occupational safety law. The doctors who recommended radium products were following the science of the moment. The science of the moment was killing people. It took bodies and lawsuits and a generation of dead women to change it. 5. Doctors who recommended cigarettes. From 1946 to 1952, R.J. Reynolds ran one of the most successful advertising campaigns in American history. More doctors smoked Camels than any other cigarette. Physicians received free cigarette samples at medical conferences. Some prescribed smoking for anxiety, for weight management, for throat irritation, on the theory that smoke soothed inflamed tissue. A 1930 advertisement for Lucky Strike cited the endorsement of 20,000 physicians. The link between smoking and lung cancer was visible in the data by the early 1940s. The industry funded research designed to produce doubt and produced it successfully for 2 more decades. What makes this entry different from the others on this list is that the doctors who endorsed cigarettes were not simply mistaken. They were operating inside a system that was being deliberately deceived by people with enough money to sustain the deception. Your grandfather's doctor did not tell him to stop smoking because the information that would have made him say stop was being buried. The Surgeon General's report arrived in 1964. By then, the cigarette had carried medical endorsement for 30 years. 4. Heroic medicine. When George Washington woke on the morning of December 14, 1799, with a severe throat infection, 3 physicians saw him before evening. By the end of that day, they had removed roughly 40% of the blood in his body. Heroic medicine held that disease resulted from excess stimulation. The cure was aggressive depletion, bloodletting, violent purging with calomel, which is mercury chloride, induced vomiting, blistering of the skin. Washington almost certainly had bacterial epiglottitis, a serious but potentially survivable infection with rest and supportive care. The bloodletting killed him. Calomel, the mercury compound prescribed for fevers, for syphilis, for children's teething pain, caused mercury poisoning in patients who survived long enough to receive repeated doses, salivation, tooth loss, neurological damage, administered by physicians who believed completely in what they were doing. The heroic era ended not because a single study disproved it, but because the accumulating bodies eventually became impossible to explain away. Medicine abandoned it slowly, fighting the whole time, because the men who had practiced it for decades could not accept that the treatment had been the disease. 3. The lobotomy. Between 1936 and the mid-1960s, approximately 50,000 Americans received a procedure in which the connections to and from the prefrontal cortex were surgically severed. Walter Freeman, its most prolific practitioner, performed the transorbital version with an ice pick-like instrument inserted above the eye, tapped through the bone with a mallet, moved to sever the frontal lobe connections. He performed it in his office. He performed it on patients rendered unconscious by electroconvulsive shock. He is documented using a kitchen ice pick when he could not locate his instrument. He performed over 3,500 lobotomies in his career and drove a vehicle he called the lobotomobile across the country, demonstrating the technique at state hospitals. Rosemary Kennedy, the sister of the future president, was lobotomized at 23 on her father's instruction. She spent the remainder of her life in institutional care. The Nobel Prize in Physiology or Medicine was awarded in 1949 for the procedure's development. It was not performed in secret. It was performed in hospitals, published in journals, celebrated in the press. It destroyed the personalities, the cognition, and the interior lives of the people it was used on, and it faded not from a single reckoning, but from the slow accumulation of what the patients looked like afterward, what they could no longer do, what they could no longer feel. 2. Maggot therapy. Soldiers in the First World War who had lain on the battlefield for days with open wounds sometimes arrived at field hospitals with wounds that were not infected. A Johns Hopkins surgeon named William Baer noticed that the maggots had eaten the dead tissue and left the healthy flesh untouched. He began applying them deliberately to bone infections in children. The results were published. By the 1940s, antibiotics arrived and maggot therapy was abandoned almost overnight. It was old. It was primitive. Penicillin was the future. Then MRSA arrived, antibiotic-resistant infections that no drug could reliably touch, wounds that would not close. In 2004, the FDA cleared medical-grade maggots as a prescription device for wound care. Lucilia sericata, the green bottle fly, raised in sterile laboratory conditions, is applied to non-healing wounds in hospitals across the country today. They consume dead and infected tissue with a precision no scalpel can match. They secrete compounds that inhibit bacterial growth, including against MRSA. They stimulate healing in the surrounding tissue. The treatment abandoned as primitive because antibiotics made it unnecessary is now being used on the infections that antibiotics created. Medicine dismissed it. Medicine needed it back. 1. Leeches. In 2004, the same year the FDA cleared medical maggots, it approved another device your great-great-grandmother's doctor would have recognized immediately. Hirudo medicinalis, the medicinal leech, is an FDA-approved medical device. It is on the shelves of hospital pharmacies. It is prescribed by surgeons and applied to patients in recovery rooms today. Leech saliva contains hirudin, one of the most potent natural anticoagulants ever identified, along with vasodilators that increase blood flow and anesthetic compounds that reduce pain at the site. When a surgeon reattaches a severed finger or reconstructs a skin flap, the venous circulation in the reattached tissue often cannot keep pace with the arterial supply. Blood pools. The tissue dies. A leech applied to the site draws the pooled blood, keeps the circulation moving, and buys the tissue the days it needs to form its own venous drainage. It does this better than any pharmaceutical alternative yet developed. The leech was the symbol of medical quackery for 2 centuries. Bloodletting with leeches applied by barber surgeons who had no understanding of what they were doing became the emblem of medicine before science. And then science caught up and found that the leech itself was never wrong. The application was wrong. The understanding was wrong. The tool was right. Your great-great-grandmother's doctor pressed one against her skin, believing he was draining bad blood. The microsurgeon pressing one against a reattached hand today knows exactly what the hirudin is doing at the molecular level. The leech did not change. The knowledge around it did. Medicine has always been a record of what humans knew at the time and what they were willing to admit they did not know. The treatments that faded into history were not invented by bad doctors. They were practiced by confident ones. The distance between those two things is where most of the damage happened. Tell me in the comments which one surprised you most. The next video is already waiting.